All right, we're all set. We're going to be talking about tennis elbow today, and we're going to be using Mike's elbow. Mike, say hi to everybody.
Hi.
All right. Now, tennis elbow, the previous video talked about all the things we do in the office to treat it. And it's okay to get treatment for your tennis elbow. Today it's going to be talking about what you can do for it at home. First, what are we treating? We're treating the common extensor tendon on the elbow. What does that mean? Right in through here, it's a tendon where several different muscles attach, okay? You have the extensor carpi ulnaris muscle attaches here and it runs down into the pinky, all right? You have your extensor digitorum muscle, we'll use black for that, okay? That goes all the way down to these guys, okay? These two fingers, all right? And that's a very important diagnostic test when we talk about what's wrong. Is it really tennis elbow? Then you also have other tendons that go over the top. Your brachioradialis muscle, that's when you do using a hammer. Hammer curls for athletes or people that just use a hammer. It goes over it. So it's not part of the common extensor tendon, but it does share common attachments through this area. On top of that, we also have a little muscle in through here called your anconeus, which is a extensor of the elbow. All right? So there's lots of things that are in there. If we want to make it even a little bit more interesting, because is it really your tennis elbow? Well, guess what? There's a little nerve that goes right through here. A branch, superficial branch of your radial nerve goes right through there, because it could be a nerve entrapment. All right? And there's also a ligament that holds it all together. So there's lots of things that are in there. But we're going to be talking about tennis elbow when you have that middle finger sign, which means when you push up here, it gives you pain up there. If when your elbow is straight, you're also recruiting that brachioradialis. If when your elbow is bent, you push up, it's just here. It's probably that extensor digitorum going into the common extensor tendon. So that's a little bit of anatomy for you. How are you going to treat it? The first exercise we like to start off with is some simple strengthening of the fingers to open them up. You take a CLX band, one loop, tighten it up. Go ahead, Mike, you can hold on that. And open and close your fingers. All different combinations and directions, all right? Thumbs down, fingers up, out, in. You find that spot where you can do it and it kind of makes it work, but it's not super painful. That's this exercise. If you don't have a TheraBand CLX, you can use a rubber band to do the same thing. Now that rubber band's not that much resistance, but it works real well. You can also buy other agents online. Then you need to work these muscles. Take a hand exerciser and squeeze it. All different combinations, getting all the different finger muscles. So now we're doing the opening, we're doing the closing. You have to balance it. These muscles all do the opening, but you have to balance it with the flexors, all right? After that, then you want to make sure you're getting enough lengthening through here. The best way to stretch that on your own is called waiter's tip stretch. Just like a waiter looking for a tip. Really bend that wrist and crank the arm, and it stretches that whole common extensor tendon right through here, all right? As you get better, we know that tendinopathies, because it really isn't a tendinitis, it's a tendinopathy, and if you want more information on that, watch my video, What is That Pain? To treat tendinopathies, eccentric loading is the way to go. And the way to get eccentric loading on your common extensor tendon is with a flex bar, all right? So, you use the flex bar, TheraBand flex bar, you contract, there's no pain. Load the bar, extend the arm out, the wrist is still up. Now you're going to eccentrically load it. It's called the Tyler twist, referenced in the medical literature, effective for lateral epicondylitis, all right? Tyler twist, start there, load it, extend, and then eccentrically load. The TheraBand flex bars come in all different strengths. Red's is a good entry level. Yellow's the easiest. Then it goes to green. Then it goes to blue. After that, you can start doing perturbations or shaking it in different positions to get more aggressive. But you got to start off with those first. So those are the home care exercises.